Before we get into this week's episode of Life is Better with You Here, we would like to offer our audience a content warning. We will be discussing sexual health, STDs, STIs, and HIV/AIDS. Information provided in this episode is meant to inform our audience on how to take care of their sexual health. However, we understand that some may find this discussion unsuitable. Please join us next week if you choose to skip this episode. Welcome to the Life is Better with You Here podcast with Dr. Childs. Here, we want to help, and where there's help, there's hope. A short disclaimer. This podcast is not a replacement for therapy. If you feel you need treatment, we strongly suggest you visit your physician or go to withyouhere.org/therapists for assistance finding a mental health provider. Our topic for today is protecting your genitals and HIV/AIDS. With special guest Lisa Pointer. Now here's our host, Dr. Childs.
Hi, and welcome to Life is Better with You Here. My name is Dr. Shavana Childs, and we are so glad you're going to join us today. We're going to have a talk about our sexual health and protecting our genitals. Our guest is going to be Lisa Pointer. She is a healthcare worker with extreme experience in this field. She has a lot of knowledge that she's going to share with us, and her energy is beautiful. So you're going to enjoy this. We're going to share some facts. We're going to share some safety tips. We're going to share some statistics because you know I love to share statistics with you all. But before we get started, we're going to have a mindful minute. Okay, we're going to sit back. We're going to relax. We're going to get our minds and our bodies ready to receive all of this knowledge. So sit back, find a good space, whether you're laying down, reclining on the couch, sitting in your chair. Be in a comfortable space to do this 1 to 2 minute quick breathing exercise. Okay? So, the easiest body only technique for relaxation is something you've been doing since your arrival in the world. Breathing. It comes easy to us. Everyone breathes, but few know how to breathe for relaxation, and there is a difference. Stop now and take a truly relaxing breath. Inhale through your nose with a shallow breath and exhale through your mouth. Inhale slightly more and exhale now with sound. Inhale more deeply and again exhale forcefully. Get it all out. Inhale to capacity and exhale completely, emptying your lungs all the way. Repeat this breath cycle 10 times, okay? So inhale, exhale. Inhale, exhale. Feel the tension leaving. Inhale, exhale. Inhale, exhale. One more time. Inhale, exhale. You will do that 5 more times or until you feel completely relaxed. Maintaining a steady rhythm of inhalations and exhalations as you breathe. Now that you're fully relaxed, I hope, and ready to move on, we are going to talk about our sexual health today. Just like we check in with our mental health and just like we check in with our physical health, our sexual health is equally important. And so a few of the statistics that I want to read to you guys specific to African Americans, because as you know, we have a healthcare disparity when it comes to our population. This is no different. There's still a healthcare disparity here for us. So out of approximately 36,801 new HIV diagnoses, we account for 42% of that population. We're only 12 to 13% of the United States, yet we're accounting for 42% of new HIV diagnoses. The other things not just with HIV, but also with other STDs. We are being disproportionately affected. So I'm going to read here just a few more things that I found out. Gonorrhea rates are 30 times higher in African Americans than they are in white people. African American women, my sisters, my queens, we're at higher risk for genital herpes. Okay. And so this is why we want to have these conversations. We want to educate. We want to talk about this. I don't know how old you are, but we remember that Salt and Pepper song, Let's Talk About Sex, Baby. Let's talk about it. We need to be informed. This is not something we need to shy away from, feel stigmatized about. We need to know this information. Okay. So, with that, I'm going to introduce Lisa Pointer and I will let her start and give us this beautiful information that we've been waiting for. Lisa?
Hey everyone, my name is Lisa Pointer. I'm a licensed community health worker and I work here in Northeast Ohio. I am excited to be here today. So, couple things. These condoms, they're they're free. You get them from the Department of Health. And there's a lot of myth around condoms. But one thing I do for my patients is I just put them on. I've had young ladies say, "Oh, he said he didn't fit." I think it can fit, buddy. And I always do the scratch test because the condoms today are amazing. Like I'm actually scratching with my nails and I didn't break it. So having condoms, checking the dates on the condoms, those things are important. Um, before I, get started, I just want to say we are I feel like we're in our own little crisis with new rates of infection with HIV, syphilis, hepatitis C, all the STIs in our community, and something has to be done because women are being disproportionately affected by these numbers. When you go to look at the statistics, like you said, 42% of new HIV diagnosis. That's crazy. Um, let's see, this is another one. In 2018, for every 100 Black Americans living with HIV, 63 received some care, 48 were retained in care, and 51 were virally suppressed. We need also to know who has HIV so that we can get that person medically compliant. Because it's one thing to live with HIV and you're taking your medicine and you're undetectable. We hear a lot about you equals you. Undetectable means you can't transmit it. But for our friends in the community that have HIV, they don't know their status and they're engaging in sex with multiple people. That's where we're looking at community spread. And that's a problem. So,
So, Lisa, I'm sorry to interrupt. So there
mhm.
you said some very good things and some good information. Can you go back and can you explain to me what viral suppressed means?
That means that they are taking their medicine. They're medically compliant. They're going to check in with their doctor. They're taking their HIV meds, and they're not able to um, transmit, the virus. That's what we want. We want everyone to become medically compliant.
Okay. Thank you. Thank you. Thank you. And the other thing I heard you say is, there are a lot of us out there who might have it and not know it. Can
Right.
you talk about why that looks the way that it does?
Okay. Well, one thing I see at the hospital I work at, there's a culture of people will come in and they expect if I have a STI, I can just get an antibiotic shot in my arm or my buttocks and I'm good. And that and I can get some urine. We need your blood. We need to test your blood because if you do a urine test, that's only gonna check for gonorrhea, chlamydia, trichomonas. You have to do the urine plus the wet prep. But what we're trying to, again, with the grid that I'm on, we're trying to move towards universal testing so that everyone that's coming in for an STI check, there's no reason why you didn't get tested for HIV, syphilis, and hepatitis C. And those are checked through your blood.
I love that.
Just
I
trying
love
to,
that initiative.
yeah. Because in our other partners states where they have universal testing, they're able to see where the problem is. Like, okay, these zip codes have a high rate of spread, and we need to do more community work here because we can tell where the issue is versus we just don't know, and we're out here blind, and people are being infected, and their lives are being infected.
thus impacting our community.
Yes.
And so I love the condom demonstration. That was amazing. So, and you were speaking about how serious this is in our community and the multiple STDs, STIs that are out there. And so I will let you go on and talk more about that.
Yeah, one thing I've done with the grant that I'm on, we ask certain questions when people come in for an STI check. Um, so some of the questions we ask, which is what causes me to have concern, um, in the past 6 months, um, have you had sex with men, women, or both? Great question. Nothing wrong with that. The next question, in the past 6 months, how many how many men or women did you have sex with? That number, there's a big disparity with what women are saying versus what men are saying. And I am in no way bashing any sex. I love all of our people equally, but
Mhm.
the numbers are telling a very serious story because when I'm asking women that question, there it's one or two. Usually they broke up with a person because they'll explain like, yeah, I broke up with such and such in this month, and then I started a new relationship, and I just want to make sure I'm good. I've literally had young men pick up their phone and scroll like, hold on, let me check. And they're counting their text messages and they're counting their call logs.
Wow.
And then when you go to the next question, and this is why these questions matter because how many times did you have anal sex or vaginal sex where you did not use a condom? That is the next question. And when we hear 0 times that you had that type of sex
Hmm.
and you did not use a condom, then you couple that with how many people that you're having sex with, then we get a big problem. We have a big problem. And I think some of that is with how we condition young men and socialize young men and women.
I
It's very
agree.
different. It's very, I mean, you're of the generation that you better be smart, you better go to school, you better go to Sunday school, you better go to college, you better be something. We were socialized to be nice.
Hmm.
And our young men were socialized totally different to be aggressive, to get what they want. And in that, we are we are reaping something that I don't think we expected that we were gonna get as a society, as a
And
black.
I agree with you because I was going to ask about women reporting, oh, one or two people, and guys are like, oh, let me check my Instagram, my Facebook DMs, let me check. And they're like, okay with that. But like you said, the way we're socialized
Yeah.
is girls should be nice.
Yeah.
Girls only have one partner. We don't
Correct.
sleep with a lot of people. And that's a stigma that gets put on young women that if
It
you
is.
have a partner or more than one partner, or you've had multiple partners, then you're labeled.
Yes.
And so, do you think that some of that is the reason that you have women coming in saying, oh, it's just one person and I started a new relationship and not pulling out their little black book?
And I wanna clarify, we do have some women who are sex workers, who are sexually liberated. That is not the norm, and we're just looking at our data. That is not the norm. That is a very smaller subset of our data.
Okay.
Uh, and I try and make all of our patients feel as comfortable as possible. I let them know, listen, I love you. I am here to take care of you. I do not care. I'm not judging you. I need you to get accurate information so that you can live the life you deserve. And I don't want any sexually transmitted infection to compromise your level of happiness and your routines that you have or your dreams for the future. So I really try and be authentic and
Mhm.
and let them feel comfortable. And I know it's a short period of time, but establishing rapport is so important because I don't want them to get turned off by my level of questioning. Um, and I just want them to know that I am really here for you and I want you to get your power back.
Okay.
Whatever led you here to where you are coming in here for an STI check, I don't care. I want you to leave here with the knowledge you need. And I don't want to see you again unless you work here. So that's the other thing. You know, it's hard work. It's a lot of hard work,
Mm-hmm.
but it's intentional.
Okay. And the work that you do is intentional. It's very much needed. We need a safe space to say what we need to say and not be scared to get tested. A lot of people, I think, our rates are sometimes higher is because we don't have access,
Yep.
or when we go in, we say these are our concerns, and sometimes they're often dismissed, and
y-
further testing isn't done. So
Yeah.
there's also this part of there's also this part of advocacy that we need to have for ourselves and take care of our sexual health,
Right.
you know, and dispel some of the myths that we have around HIV, AIDS, and any other STDs or STIs.
Right.
Because I think, most people think that you get HIV because you slept with somebody who was a homosexual.
Right.
That's not the truth.
No.
That is not the truth. And I'm looking at my statistics here um, for African American people, and most for women were through heterosexual contact.
Yeah.
Most of that was through heterosexual contact. 8% was through IV drug use.
Yes.
Only 8%. So 91% was through heterosexual contact.
Yes.
Okay, so that dispels the myth. We had all these negative myths about HIV and AIDS when it first came out, this being a gay
Right.
disease. It is not a gay disease. It is a human being disease.
Yeah.
It is a human being disease. And for men, 79% was through heterosexual contact. For our African American men, 14% was through, oh, I'm sorry. Let me correct that. 79% was from male to male sexual contact. Only 14% was heterosexual. IV was 4 for drug use, and sexual contact and IV drug use together was 3%. So there's just this big disparity going on here. And with the numbers knowing actually how it's transmitted, we all need to be careful. We all need to be honest too
Yeah.
about what we're doing and who we're doing it with.
Yes.
And I think erasing some of the stigma that we have that I think, and I might be wrong, but I think is particularly with women
Yes.
and sex. I feel like we're not supposed to enjoy sex. We're just supposed to have sex for procreation. We're human beings too, just like men. We
Right.
enjoy sex,
Yes.
you know? And so there needs to be that out there. And I'm glad we're being educated and we have people like you that are speaking to us and telling us those things.
Yes. Really quickly, I have a funny story about a patient I just talked to this week. She was coming in for STI check, and she did end up having I think trichomonas and chlamydia. And we were like, listen, you are gonna be fine. We're gonna treat you, we're gonna take care of you. You're good. She was like, no, I'm not good because I'm only with one man. And I could have been with somebody else. And she realized that it was her partner. And this was not her first time coming to us. She was a repeat. So that means your partner has stepped out twice and brought you back a gift that is not pleasant. So I was explaining to her, like, part of you getting your power back is knowing your status, but also encouraging your partner to know their status too. And this is a good way to weed out people who are not meant for you. We do a lot of settling at different stages in life and for various reasons. We cannot settle with knowing your status. It is a non-negotiable. You have to know your status, and the person that you're with, you need to know their status as well. And if they're not willing to give it to you, then that might be a sign that there's someone that you don't need to deal with. Because this is a young lady who has been infected twice. And the scary part is that she is pregnant now.
Oh,
And when you think of things like birth defects, when you think of things like trichomonas, and that some of these STIs are parasites, and you think about the fact that there's a child in your belly, we don't want parasite impacting our unborn children. Some of the stories that I see and some of the people that I see is just amazing. I had a young man who thought, myth. He thought that because his baby mother was tested last week and she was good, that he didn't need to get tested. Now, this is his child's mother. She's 6 months pregnant and she's tested and she's good. But when we asked him, go back to these questions, in the past 6 months, how many people have you had sex with? And he said 7 people.
Wow.
And when I asked him, I said, you need to get tested for not just your safety, for the safety of your unborn child. He said, no, I don't want to because she got tested and I'm good. That's a problem. And he's not the first one I've heard, unfortunately. So the only way that women are going to be able to get their power back, men and women is making sure that your partner gets tested and they present that information to you and not just a gonorrhea, chlamydia, wet prep. You need a full panel.
I absolutely agree. And so it is funny that you bring up that myth. I was on the internet looking at some other myths, and that actually was one of them. Is thinking that if your partner got tested, you didn't need to get tested.
Yes. I hear it all the time. And it's crazy business. Like, you have to know your own status for yourself because what if something is dormant in you? Or what if you're a healthy person?
Mhm.
Like with HIV, if you're this is not for all cases, but for some people that are extremely healthy,
Mhm.
that well and work out, it may not present the way it would as someone that's sick with diabetes and high blood pressure and other comorbidities. So it's really important that everyone know their status. We had a guy that had HIV for years and didn't know it because he was healthy.
Wow.
Because
So
he was
there
healthy.
there are STIs, STDs that can be dormant in your system and you not be aware.
Herpes. There are some people who have herpes who've never had an outbreak or who had an outbreak and thought it was a pimple and it's gone. And but when you test them, they have these things. And I think it's like 1 in 4, the statistic for herpes. 1 in 4 people, 1 in 4 Americans.
Wow. And
That's
that's a large number, but we
a large number.
stigmatize herpes
Yeah.
like only a few people have it and it's this horrible, deadly thing and
No.
only trashy people or only, people who are sexually inappropriate or
It's
sexually,
the rest.
yeah, promiscuous. And the reality of it is it could be 1 in 4. So if
Right.
you know 5 people, if you got 5 people in the room, the likelihood is
Right.
one of them has herpes.
One of them has herpes. I do this with my patients a lot. We'll just open the door. I'm like, how many people you think out there? They're like 20, 30. I'm like, exactly. 1 in 4. I want you to start doing the math quickly now. So
Mhm.
I don't want them to feel like they're alone. When they get a new diagnosis, it's not 1989. You're not gonna die a horrible death if you get HIV. There are people who are living well into their 80s and 90s who are living with HIV. It's not a death sentence. Herpes is not a death sentence. All of these sexually transmitted infections are treatable, but we need to know who has them and treat them and get everyone med compliant. That's the biggest thing.
I love that. So the other thing, I'm going to go over a few more of the STDs and you can give me the facts on these cuz so one of the first myths is only trashy people get STDs. What do you say to that?
Was working at the University of the District of Columbia in Washington, D.C. And I was tabling. I had my condoms, I had my dental dams out there. I'm telling people about condoms and I'm trying to get everybody safe, right? And I saw a woman who was a little bit older, and you can tell when someone is uncomfortable and they might not want to approach your table. I'm always trying to identify people like who need me, okay? If I go, I walk with her, I talk with her. I know she's got a ring on her hand. She's got to be in her 60s. And I'm assuming that she's coming to get information for her grandbabies or her kids. So I'm telling her about pre-exposure prophylaxis. I'm like, yeah, it's a once daily pill you can take so that you don't contract HIV. I'm telling her about PrEP. I'm telling her about the dental dams. I'm like, and these are flavored and y'all know where everyone's mouth's been. We're just having a good conversation. And she's just eating it up. She took a bunch of stuff. She took my card and she left. Fast forward, I see her maybe 6 months later. Her ring is gone. She's like, you saved my life. She run up to me like, you saved my life. And I'm like, okay, hey girl. And she's like, well, She's like, I've been with my husband since I graduated high school. I was raised Southern Baptist, but a couple years ago, I got infected with syphilis. She's like, then right before I came to your table, I went for my well woman exam and they said I had chlamydia. She was like, I don't know what another man smell like. She was like, I was raised right. I have my values, my morals, and I stick by them. And she was like, he was cheating on me. He had some unexplained charges, and she'd give me the background. I'm like, oh my Lord. But I had told her about PrEP. She was like, after I talked to you, I went and told my doctor. My doctor put me on PrEP. And I started using the SC2. I told her about the SC2 condom, which is the female condom, which can be inserted into the vaginal canal 15 minutes prior to intercourse. I told her about that. And then she told me something that broke my heart. She was like, I never had foreplay from my husband. This lady she was in her
Wow.
60s. And she was like, well, I knew if I put the female condom in, he wouldn't know. He wouldn't know. She was like, I just put lube in, I put the condom in. And she was like, he wouldn't know because he don't never even go down there. Oh, I can't imagine a life like that. But this is the reality for some women
Mhm.
who are socialized this way, and there's a big disservice. But long story short, they were getting divorced, and he did not want to share assets with her. But when they were in mediation, he told his lawyer to explain to her that she needed to get tested for HIV because he had contracted HIV from one of his mistresses. And
Wow.
she was like, I don't need to get tested for HIV because I get tested every Friday with my doctor. She was like, I've been on PrEP because I know you've been cheating. She was like, you have HIV, I don't have HIV. And he lost his mind in that mediation. He actually got locked up because it was shown that he knew that he had HIV and did not disclose it to her. So he was actually being harmful and deceptive. Um,
Mm.
and then she was able to use the fact that he gave her two other STIs and that she didn't have any other partners. So she ended up with everything. But I think, about what if I didn't go talk to her? What if we were out here doing this advocacy work and trying to just be friendly and let people know that you don't have to have this shame that's on people. That it's okay to talk about sex, that yes, you deserve to orgasm.
Mhm.
Because one thing that killed me if I called an STI for somebody and I didn't get an orgasm. So, but these are realities like that
You're right.
that we need to talk about, that you deserve to experience pleasure. You deserve to be safe, and that your partner should be a safe space for you to explore and have fun in your sexuality. So,
I absolutely agree. And thank you for that story. That is an amazing story. And it goes to show that if we protect ourselves, we can be
mhm,
okay. We can be
yep.
okay. We just need to know to get tested and not be afraid to go get tested, not be
Right.
afraid to advocate for yourself with your doctor. And if you feel like you have a doctor that's blowing you off or dismissing you,
I
get
don't know.
another doctor. That's how powerful we are. Just go get another doctor. You are in control of you. You have the power, so you can do that.
Yeah.
So, one of the other myths, and I'm sitting here giggling, but there are people who think like this, and I don't know if it's because we don't want to face it, it's something we don't want to think about, but we think if my partner had an STD, I would see it. Would you really?
Unless they having a herpes outbreak or they have severe syphilis where it's presenting on their hands and genitals, no, no, you won't see it. You won't see it, and you need to get tested. Everyone should get tested. I recommend in and out of a relationship, but also, so yes, you should get tested before you get in a relationship, so you know that what you and your partner are bringing to the relationship. You should get tested going out because you don't know what you could have got during, but also you should get yearly checks as well. So however that works for your timeline, gotta do it.
Well, for me, if you're getting a yearly check and hopefully you're also getting a yearly physical, during your
Right.
yearly physical, ask for that blood test or that urine
Full
test.
full panel.
Ask for everything because you
Yeah.
need to know your status, not just sexually, you need to know your health status. So
Exactly.
we need to be aware, but our sexual health is just as important as our physical and mental health.
Yes.
Because, contracting one of these diseases is definitely going to take you to a different mental health space. Anxiety, depression. I've spoken to clients who are getting divorced now
Yes.
because they contracted herpes and it wasn't anything she had done, but it happened in a delivery room.
Right.
And in the delivery room, she had not been with anybody else. And her husband understood. He was okay with it. He loved her unconditionally. But she was so distraught that
Yeah.
she had this nasty disease. She
Yeah.
felt worthless. She felt useless. She felt helpless. And she didn't want to damage his life any further. So she ended up divorcing a man she had been married to for a long time.
That's hurtful.
And it was very hurtful. She was hurt. She didn't know what to do. And her thought was, I'll never have another relationship because who's going to want me? And
Right.
that's not true. So
No.
again, this is how these things can affect our mental health. We need to be aware. We need to be tested, even if we're scared to be tested. I always tell you guys, you can be scared and you can do it anyway. I'd rather know,
Yes.
not know.
Yes.
I'd rather know than not know. And so then I can choose what I'm going to do. And then you could protect whoever else is around you.
That's it. That's it. Spoken perfectly. Yes.
So, one of the other myths, and you also spoke to this already, is you can avoid STDs by having anal or oral sex. Could you please speak to that?
Anal sex, if you don't have the right lubrication, anal sex can be a violent, painful, multiple tearing sexual event. Okay. So you are more susceptible to tears and abrasions from anal sex than vaginal sex. So your chances of being exposed to things like HIV, hepatitis C, syphilis, all of those is greater. Um, and the same with oral sex. Also, with oral sex, one thing I want to talk about, and I wrote this down, make sure your partner that you're having sex with has been to a dentist.
Hmm.
Because the bacterial vaginosis, when we find that your pH is off or that you have an infection, a lot of people discredit the mouth and they discredit the fingers. But if someone is going to touch you, if you are allowing someone the privilege and the honor of pleasuring you, I would hope and pray that they are washing their hands. We cannot just come from outside and have sex. Wash your hands, take a shower together, and let's normalize other ways to be intimate, other
Mhm.
non-sexual forms of intimacy. So let's take a shower together. Let me cleanse you. Let me make sure you wash your butt because the number of women that are coming in with bacterial vaginosis and needing to take a pill, antibiotic to get rid of these things is just ridiculous. And a lot of that could be from dirty fingernails, touching your clitoris, touching your vulva, touching your breast, and dirty mouths. They gotta look good on the inside and out. We need to be engaging in sex with healthy individuals all the way around.
I like that. I like that. Never thought about the cleansing of the mouth and having a clean
Well,
mouth and how that can. And Lisa, tell us how you really feel.
listen, oh my gosh, just the dirty fingernails. Like I know, and we have a lot of stereotypes too. And a lot of this is there are cultural shifts that have to happen within. I'm only black. I can only speak on the black community. But within our community, things that we consider to be oh, that's gay, getting a
Right.
manicure is not gay. You don't when you said you gotta go get a full set, but getting these things filed, you know, getting those hangnails off, which could really
Hmm.
cause damage. You're down there trying to be a DJ on somebody's clitoris and you could cut them up and infect them with your dirty nails. But we do not want that. Um, let's make sure
Thank
your
you.
hands,
Thank
let's
you
make
for
sure your
that.
hands are clean.
Yeah, thank you for that metaphor. That's hilarious. I cannot get that out of my head. So,
Oh
but
my gosh.
I love we can have fun with this and talk about
Yeah.
it in a fun way because we need to loosen up. And
Yes.
we need to be aware of our bodies, what it looks like, what it feels like, what's right,
Right.
what's wrong, and get it checked. You only
Yes.
get one,
You only
okay?
get one.
You only get
I know.
one. Okay, and so the last one that I have here is once you've had an STD, there's no chance of you getting it again.
We've had a lot of myths pop up in the age of COVID and internet doctors. You know, you have spent a lot of years getting your doctorate, and I do not have my doctorate. So there are going to be certain things that you're going to be an expert on. There are going to be certain things that I'm going to be an expert on.
Mhm.
But these myths have gotten out of control. And I've seen them on TikTok. I've seen people go into whole think pieces about it. I'm like, there is no immunity with STIs. That's why we have repeat patients who come in, they have the same thing again. You're getting it from the same person or the same community because there's community spread in the zip code. You know, this zip code might be high. Um, no, there is no immunity. There's no herd immunity with these STIs. You can be reinfected and you can die. Like you can have, like if you have untreated, syphilis,
Mhm.
it can mess up your spine, your brain. You could die. Like these are side effects. Like these are real. I don't have
Real
one,
life side effects.
but these are real life side effects, and it's nothing to play with. Your children can have birth defects. It's just too risky to not have safe sex. I mean, you consent to having a good time. You consent to an orgasm. You do not consent to having your body betrayed by the STI.
I like
So
that. Okay. So we also have this section that we call where there's help, where there's hope, there's help. So
yes.
now we want to talk about the help. What can we do to protect our bodies? What would you want people to know about protecting themselves from STDs, where they can get help, where there's hope for them?
So everyone doesn't have the privilege of having a primary care physician or OB that they go to. So if you need some quick help, always come see one of us at the ER. I know St. Vincent's is closed, but you have Metro Health on West 25th. You have Cleveland Clinic's emergency room, and you have University Hospital's emergency room. You can come and be treated right away. And that's no matter what city you're in. If you have an ED, an emergency department, you can go. You can be treated. If you have an STI, like that requires an antibiotic, they can give you a shot or pills right away, send you a prescription to your local pharmacy. Um, and there are things like charity care. So if you cannot afford to pay for your bill, you will be stuck with a bill at different hospitals. But there are also local organizations like Care Alliance, the centers. There are what I like to do with my patients. I'm like, you got a smartphone? Let's pull it out. So we will go and we'll type in treatment centers. You have Planned Parenthood. You have these different organizations, and you could just type it in. I need help with X in this city, and a list will populate for you. We have these smartphones. We got to use them. Um, so there is help out there. There are so many organizations you can go to. The AIDS Task Force.
Mhm.
You can go to your local health department and get condoms. All you need to do is know where it's at. And if you don't have access to a computer, you can go to your local library. A librarian can help you. If you need to print out information, there's help there. So there is help in the community. You just got to look for it or find one of us in the ED and we'll help you.
Lisa, you have been amazing. The
Yeah.
information has been amazing. I really want to thank you for being here and sharing this with us. I know it is helping somebody. And I just want to say for everybody out there, get yourself tested. Don't be afraid. What's the worst thing that's going to happen if you get tested? You're going to figure out your status and then you'll know what to do. But if you don't get tested and you're out here and you don't know what's going on with your health, that can be very detrimental. Okay. And so, my affirmation for you today is my sexual health is just as important as my mental and physical health, and I will check on it regularly. And remember, regardless of your journey, life is always better with you here. Thank you, and we will see you soon.
Thank you for listening. This has been the Life is Better with You Here podcast with Dr. Childs. For more episodes, you can find us on Apple Music, Spotify, Google Play, YouTube, and many more. We would also like to give gratitude to our sponsors, the Ohio Suicide Prevention Foundation and Global Insight Productions, without whom we wouldn't be able to do this. For more information about our sponsors, please visit ohiospf.org and globalinsightpro.com. We would also like to thank our special guest, Lisa Pointer, for joining us today. And don't forget to visit our website, withyouhere.org. We look forward to seeing you next week. If you have any suggestions for future episode topics, feel free to leave us a comment. Also, if you or someone you love is in crisis, please call 988 or text STEVE, STEVE, to 741-741 for free and confidential support 24/7. And again, thank you.